15,000 kilometers away, on the shore of the Indian Ocean, a team of Tanzanian doctors are doing their best to meet the same formidable challenge. In a context where healthcare is highly precarious, to give children in their country access to the progress made by medicine in the field of cancer. The Ocean Road Cancer Institute in Dar es Salaam, run by Dr. Twalib Ngoma, is the first and so far the only cancer treatment center in Tanzania. Over 3,000 patients are treated here each year, including 300 children with a high proportion of Burkitt's lymphomas. This form of cancer is in fact particularly prevalent in children, and in Tanzania, as in all of sub-Saharan Africa, its incidence is high. 7 cases for 100,000 inhabitants per year up to the age of 15. Dr. Ngoma has set up a nationwide program for detecting and treating Burkitt's lymphoma. At the same time, in spite of extremely difficult conditions, he and his team are working to improve the treatment and accompaniment of children with cancer.
How many patients do you have today?
We did 20 patients.
20? 20 children. They look more than 20, eh? The others are outpatients. Now, at the moment, these are the children with Burkitt's lymphoma on treatment here. Jackson, ulipokuja ugonjwa ulikuwa wapi? Hapa? Australia? Yeah, I would say the response has been very good because there isn't any trace, and you can see there is good symmetry. You can see this one, fungua mdomo. Yeah. So most of the tumor was on this side, and there is still tumor and it's going on treatment. And that one in the abdomen. Na mzee behind there. Wewe una miaka mingapi mzee? Eh? I asked him, how old are you? He said 2 years only. Without hesitation even. You can see this very good response, responding, that one very good response. That one will start treatment. These have abdominal disease, which is a bit difficult to treat and control than tumors. In the 50s, we had a missionary doctor working in Kampala, Mulago, called Dennis Burkitt. In his day-to-day work, he noticed that there are children coming with big jaw tumors. Most of the children were coming from a belt, a tropical belt. And looking at that tropical belt, one of the other common problems there was malaria. So it's easy to say probably malaria is associated with this because Burkitt's lymphoma happens in places where malaria is endemic.
This is Hilali Mohammed. His diagnosis of Burkitt's lymphoma. Yesterday he was transfused. We are waiting, maybe next week we could start the second-line chemotherapy.
So this child was supposed to start second-line chemotherapy for Burkitt's lymphoma, but the white cell count was less than 500. So we have to buy sometimes. A bit difficult. Kwa hiyo mama, mtoto ndio hivyo matibabu hajapata kwa sababu ya zile chembe ziko chini, lakini zitakapokuwa zimeimprove vizuri tutaendelea kumpa. Sawa. Pole sana. Sometimes the mother may say that, look, my child is not getting the treatment. But he has to understand that we are not just delaying unnecessarily, but it's because the general condition of the child does not allow us to give us chemotherapy at that time, and she has understood. But the issue has always been, why is it that we don't have those drugs which can help our children? For a mother, it is difficult when you see the child sometimes passing. It's very difficult, but those are the reality. We are trying.
You know, Tanzania is a poor country. More than 50% of the people are below the poverty line. They live on less than $1 a day. You have less than 500,000 in jobs that earn income out of the 36 million. Our expenditure on health per person, it's just about $10. What can you do for $10 for 1 year? It's just a treatment for one attack, malaria attack. That's wiped all the money. That is for you for 1 year.
What are the issues here?
Has received 3 cycles. Currently, her blood is not ready for continuation.
So you see again, it was bucket of the jaw, and then it actually had responded very well.
So the child had a very big mandible tumor, that one, but now it has gone. Yeah. It has gone. We get some patients who get complete remission of the tumor even after 1 cycle. For this one, after 2 cycles, the tumor has gone.
Yeah, she's getting okay. She's getting. The problem is that the chemotherapy had to be postponed because of the low white cell count. Whereas if things were going concurrently, then some patients, they are really nutritional. They are actually in a pathetic state. So sometimes we are fixed. You want to give optimal therapy, but again, you won't be able to manage the complication. So you say, okay, maybe you should give 75% of the dose and not 100% of the dose. But still we get some results. We get some results. It's just a matter of saying that, look, should I wait, watch and see, or should I act with a limited resource? I will act.